All right, so welcome everybody to today's webinar. Thanks for joining. My name is Sam Cook. I work at the Pennsylvania Commission on Crime and Delinquency. If I could just ask in our usual virtual learning environments, just to make sure everybody is muted, that'll help us ensure that we're able to hear everybody when they want to talk and don't have any audio issues that are preventable. So like I said, I'm Sam Cook. I work at the Pennsylvania Commission on Crime and Delinquency. I run the Naloxone for First Responders program. And today's webinar is about increasing access to naloxone in communities during COVID-19 using innovative naloxone distribution strategies. So we're really excited to be presenting this webinar in partnership with the Department of Drug and Alcohol Programs, who generously provides federal funding to support the Naloxone for First Responders program. So with that, I'll go ahead and get started. So we already figured out who I am. I joked that this was my pre-COVID picture. So new glasses, slightly more hair, and also some under the eye bags. But I'm happy to be here with you. Before we dive into our presentations, I just wanted to provide a quick overview for folks who may not be aware. We did open up this year's program year with some new guidelines and new opportunities for CCEs in terms of the Naloxone for First Responders program. So our 2020 to 2022 program guidelines really emphasized some new priority first responder groups. So that includes harm reduction organizations, county jails, treatment providers, among others, in addition to the traditional first responders like police, fire, and EMS that the program has historically served. It also outlined some responsibilities of CCEs and eligible organizations, provided some examples of innovative CCE distribution strategies, which is what we'll talk about today, and also provided some information about expectations for inventory controls and supply management, as well as performance measures and quarterly reporting of data. So if folks have any questions, we will send out slides, so you'll be able to take a look at this content and also link out to our webpage, but just wanted to kind of make sure folks were aware of those new guidelines, since a lot of the strategies that you'll be hearing from CCEs today really are exactly in line with what we're hoping more CCEs will adopt moving forward. All right, so next slide. So our goals for today's webinar is really to share real-world examples of initiatives that have been used by CCEs to work with community-based partners to increase the availability of naloxone in their communities and prevent overdose deaths. We also wanted to discuss how CCEs have been responding to COVID-19 and adjusting their distribution strategies accordingly. All right, so before we dive into today's agenda, just another quick reminder, if folks can just make sure that they're muted unless they'd like to speak, that would be appreciated. We also have our chat function in the back, right down on the bottom of your screen. So if you do have any questions, we'll be monitoring that. And we're gonna provide opportunities at the end of each presentation for you to ask any questions that you might have for that specific CCE. And then obviously at the end, we'll open up for questions as well. So with that, the order of today's agenda, we'll start with a presentation from the Allegheny County Health Department. We'll then move to Bucks County, and then we'll talk to folks from the Office of Attorney General and Schuylkill County Drug and Alcohol, then head over back to the Southwest to Washington Drug and Alcohol Commission, and then round things out with a presentation from York Adams Drug and Alcohol Commission in the South Central region of our state. So with that, I'm pleased to turn things over to our first presenters from the Allegheny County Health Department. Go ahead and take it away, you guys.
Thanks, Sam. So I'm Caroline Hamilton. I'm manager. Actually, you can go to the next slide, please. It'll be a little bit better. Yeah, so I'm Caroline Hamilton. I manage the overdose prevention program at the Allegheny County Health Department. So I'll be introducing some background on Allegheny County, the local overdose epidemic, for some additional information that lends itself to our strategic approach to naloxone distribution. And I'll be presenting with Stacie Brown, who is our outreach coordinator. So I'll pass off to her in a little bit. Next slide, please. So Allegheny County is in southwestern Pennsylvania. Our population is over 1.2 million, makes us the second largest county in the state. And then we actually have 130 self-governing municipalities, which is the most in the state. And as you can imagine, it's really fun to work with. But we have 4 cities, Pittsburgh being largest and typically most known. The overdose prevention program operates with, we have state, federal, and local funding. We really emphasize naloxone distribution as a part of the central part of our community collaboration and outreach, which then lends itself to some of our other strategies to improve systemic linkages to care, access to harm reduction services, and support for providers and health systems. So really central to our approach is a strengths-based partnership with partners that conduct street outreach to people experiencing homelessness or other diverse community partnerships within the Black, LGBTQIA+, or Latino communities. Next slide, please. So here we are in the middle of an overdose epidemic and a global pandemic, and the challenges are just, there's so many. So Allegheny County, we have actually seen an increased number of fatal overdoses dating back to last summer, the end of last summer entering Q3. So it's possible that the pandemic will exacerbate these trends, and we're really currently digging into our 2020 data, as we have about a half a year of data now. So, but the ODMAP program has noted a national 18% spike in overdose. So we're really aware of the environment that we're working in and how important it is that we, in spite of social isolation and other mitigation measures, can continue to get naloxone out into the community. So I share this because our outreach is driven by data as much as it possibly can be. So we conducted a hotspot analysis last summer to identify priority communities throughout the county, and then we followed up and sought partnerships in these areas. So recently, our analyses are showing Black men and women dying at a higher rate than whites, and this widening disparity is reflected within the increase in fatal overdoses overall. So even more detail shows an increase in cocaine fentanyl overdoses. So we're also looking into that as we navigate this work. Next. So I mentioned before that community partnerships and strengths of individual communities drive our outreach. So our naloxone distribution is centered on one strategy, which is getting naloxone into the hands of distinct populations that need it most. And then we kind of have 3 prongs within that. So first are just generally those most likely to witness and respond to an overdose. So considering priority populations, like I just talked about, with a higher burden of overdose risk or just of overdose overall in the fatal data. So be that people recently released from jail, a certain demographic group, or geographic area. We really look into that as one prong. Second, individuals who use street drugs or non-prescribed opioids due to the increased risk of fentanyl contamination. Like over 90% of fatal overdose deaths can be involved fentanyl. So that's really important to us to reach that population. And then third here, individuals that access opioid treatment programs or behavioral health care due to the documented increased overdose risk. So we had a report in like 2015 to 16 here in the county that found that 43% of those who died of overdose had received a publicly funded behavioral health service in the year prior to death. And so, 43%, that's a lot. So we see that as a touch point to build our partnerships and outreach with treatment programs. And we work with the Department of Human Services to do that. Next slide. So we call this our community collaborative approach. So really involves asking ourselves, how can we reach people most likely to witness and respond to an overdose? And within that, as the CCE definition and for the Naloxone for First Responder program reflects, our definition of a first responder to overdose is anyone in the community that responds to an overdose. So we ask that, and then we engage the community and partners within these groups, particularly in the priority populations identified by our data. In doing so, we've provided seed money, this is with local funding, to build sustainable community-driven response through mini grants. We work with harm reduction partners, our local syringe service program for peer outreach programs. We work with street outreach partners, professional first responders, opioid treatment programs, federally qualified health centers, which is an important touch point because a lot of people accessing medication for opioid use disorder in certain vulnerable populations are going to their local federally qualified health center. So, and then elected officials and really anyone else that will work with us. So this structure has enabled us to stay in touch with the community throughout COVID. And as we've responded in the different stages and the way that things are now with this sort of like most things are virtual, but sometimes we can, in a safe manner, follow protocols and get out into the community. So this is all of the background, and I'll pass off to Stacie Brown, our outreach coordinator, to explain more. So thank you.
Can we have the next slide, please, Samantha? Okay, so my name is Stacie Brown. I'm the outreach coordinator. So I'll talk a little bit about COVID response and then some of our community outreach that we've done prior to COVID and especially during. So when we recently received notification from PCCD stating that there was an emergent supply of Narcan, we developed a list of our priority areas and then just dove into what partners we had in there, what community leaders were in those areas, and we dispersed all of that Narcan specifically for those groups. From that, we developed a relationship with For Good Pittsburgh, which started a porch drop-off program in one of our communities. Within a week, she received an email saying that somebody's life was saved. They gave out approximately 60 kits within a month, which then led to McKeesport coming up with the same sort of program. So once again, we got together, talking with the community. How can we safely, like Caroline said, get into our communities again? Last summer, I probably did events 5-6 times a week. So we developed a list of some of the areas, communities, neighborhoods that had high overdoses, that were underserved. Keller, communities of Keller, lower income, even just a normal community that's had some increases in overdoses. So we decided to reach out to Global Links. We got some PPE from them, and we developed these Narcan giveaway days. It started off with 10 events in September. And from there, we've already gone into the second week of October. So we have about 7 more events coming up, following all straight protocol, marking the sidewalks, wearing face masks. We're giving out face masks. So far in 5 events, we've distributed 477 kits of Narcan and 668 face masks. Another pathway we're trying through COVID is virtual trainings. We're going to reach out to previous trained organizations, community leaders once again, and see if we can do some sort of virtual trainings, whether it's 5 people or 100 people. So can you go to the next slide, please? So while we're in the community, we've developed some different outreach materials. I can say that the first top left picture, that is our EMS Leave Behind kit. We purchased these white drawstring bags and we'll provide for EMS for their leave behinds our Steps to Recovery link or brochure, which Caroline is going to put the link in the chat for everybody. We have a case management brochure. We include a kit of Narcan and then whatever items that, the EMS want to also leave in there. The police toolkit, we've made black draw or zipper pouches that hold 2 kits of Narcan, a CPR face shield, a set of rubber gloves, This way they can have the pouch. It's about the size of a pencil case. They can keep it in their police cars during their shifts. But our Steps to Recovery brochure, that's the bottom left picture, that brochure itself is, we get so good community feedback from that. The first page starts off at safe using, and the last page ends at PA Get Help Now. We also, one of the things that we did with that was individuals that are on that and in it are community members, actual people that you'll see every day in Pittsburgh and surrounding neighborhoods. And everybody, I mean, we get such good things from that. We also got together and developed the bottom right corner, our safer substance use. This was one of our most recent outreach materials we're using. It's about a 3x5 size card, and it's very straight to the point, but it also has our link on there where you can obtain Narcan. We developed a bit.ly or a tiny URL link with a Qualtrics form that you can get on and just request Narcan. Can you go to the next slide, please? Which brings us to the fun stuff, reporting. Once again, we used a Qualtrics link. It's right there on the sticker. We asked 4 basic questions. I can tell you that our section for comments or stories gets filled every single report. Whether it's, we're thankful for this, we use this Narcan on this day, and this is what happened. And that works really, really good with our organizations. When we develop that first relationship, I'll explain to everybody, like, this is a report I'll send to you quarterly. You know, I'm just going to ask you 4 simple questions. But I know from personal use that just from hearing the word report compared to share stories, we get more responses from just changing that one word. So we tried to think of a way to reach community that we've given Narcan to. So we then made these little stickers, and they fit right on the side of a box. Doesn't cover nothing important, but it just says, if it was used, let us know. It also gives us another way to connect back to the community, which was great. And then, which actually will lead us to the next slide, please. So we wanted to share this. This is what I meant by our comment section. So our first event that happened the beginning of September, this was a response that we received from the kids of Narcan that we gave. So 3 days after we were in the community giving out Narcan, they saved somebody's life. For somebody to share that story, that's a powerful thing to do. So of course they want to get, they just want to tell people. So now we're able to reconnect with that individual to get them additional Narcan. And then that's the end of our presentation.
Thank you guys so much. I thought that was great. And not to interject, because I certainly want to open it up if participants have questions, but Stacie, I love that example. I know we've talked about this before, about how just a simple word change really makes sharing that story a lot easier for folks to do. And I know at least one of the questions that I've gotten most frequently as we've been updating our guidelines to allow for more innovative naloxone distribution strategies and things that are akin to leave behind, that the question really is around, well, how would we capture if the naloxone was used? And so we did update our data reporting template to allow CCEs to kind of capture where kits were redistributed to the community. So that's one way of getting that. But as Stacie noted, if you're interested in getting kind of the use data, you may want to think about considering some of those strategies that Pittsburgh's done to sort of encourage folks to share that story if they're comfortable. So thank you very much for doing that. I see we have a question from a participant about how the porch drop-off process kind of actually worked. Did you do certain porches or every porch? So could someone maybe kind of walk through that process?
Yes, I can. I was just getting ready to respond back in the chat. So how they did was they utilized social media and said if anybody would, is in need of Narcan, it can be anonymous. They added a cell phone and an email address and just said, please reach out just with your address. And within 24 hours, we'll have your Narcan on your porch. And within the first day of them putting that on Facebook, they got, I think she said, over 30 requests. So they utilize social media. They left a phone number that people could just leave a general voicemail, and they gave an email address. And they didn't have to put a name, just an address of where to drop it off. And then they even went a step further and said, we will be at this location Monday, Tuesdays, and Wednesdays from 10 a.m. to 12 p.m. If you don't want to share your address, please stop in and pick a kid up. And
great.
I also want to share, going back to the first question about where we're holding the distribution. So when we decided, a list of like 10 to 15 communities we wanted to go to for these distribution and resource fairs, we sat down, thought of the communities, and we're like, okay, what partnerships or organizations that are embedded in the community can we reach out to? So it took like 3 weeks, but we did that and started reaching out to all of them. And then we asked them, where do you want to host this? What date works? What time? So we're really, we're calling it like we're co-hosting, but we just had to kick off the initiation of the event. But we really wanted the partner in their own community to be able to say this is their event too. So.
That's great. I don't see any other questions that have come through the chat, but I just wanted to pause really quickly to see if anybody had any questions for our Pittsburgh team before we jump on over to Mallory and Sheri from Bucks County. Okay, see none, and reminding folks we'll have that opportunity at the end as well. I'm going to move on over to Bucks County, and we have two fabulous folks from the Bucks County Drug and Alcohol Commission who are going to share a little bit about their initiatives. So Mallory and Sheri, you want to go ahead and take it away?
Yes, thanks so much, Sam. If you could just please move to the presenter slide, the next slide, please. Thank you. So good afternoon, everyone. My name is Mallory Perrotti, and I'm the Prevention Supervisor with the Bucks County Drug and Alcohol Commission. We are the single county authority in Bucks County. And today, together with Sheri Rubin, we'll be presenting on the naloxone initiatives in Bucks County. So now I'm going to turn it over to Sheri so she can introduce herself and tell you a little bit more about our agency.
Hi, everybody. I'm Sheri Rubin. I'm the healthcare coordinator at the Bucks County Drug and Alcohol Commission, and I oversee our warm handoff program called B-Cares. Next slide, please. So this is just a little bit about our agency. So we are the single county authority, and our mission is to promote healthy individuals, families, and communities, eliminate the misuse, abuse, and/or addiction to alcohol, tobacco, and other drugs, and to support those in recovery from addiction. So as the SCA for alcohol, tobacco, and other drugs, our agency ensures the provision of a comprehensive and balanced continuum of quality prevention, intervention, treatment, and recovery services for the county. Next slide, please. Mallory?
So, Yep. Just to kind of give you some background on how our agency has kind of started with the naloxone distribution and where we are today. So our agency has really been the lead in the county since 2016. We were We started with working to help law enforcement carry naloxone, and then it expanded to community distribution, as well as providing to other organizations. Then in 2017, we were fortunate enough to become the CCE in Bucks County, and that really helped to open up partnerships with not only law enforcement, but with our emergency health services. So since becoming the CCE in 2017, it's just again allowed us to have more opportunities to distribute naloxone. So right now our office is working with all of our first responders, as well as our drug and alcohol treatment providers, the community, schools, and other organizations. And so I'm going to just kind of highlight some of our partnerships right now and where we provide the distribution. Talk a little bit about our Leave Behind program, and then turn it back over to Sheri to talk more about some of our new pilot programs. Next slide, please, Sam. Thank you. So, as Sam mentioned in the beginning, with some of the new guidelines and some of the focus shifting a bit on the populations that are, eligible through the PCCD program, this is just a breakdown of kind of how we've distributed units in the past. So through our PCCD units, we've been able to provide to first responders, drug and alcohol treatment providers, probation, courts, most recently with a partnership with some of the harm reduction coalitions through our jails, as well as hospitals. And then through other funding sources, we've been able to provide to communities, schools, and recovery houses. And just a little background of how we've worked with the schools were something we started a few years ago, and we didn't really come across much pushback. The schools were great in kind of welcoming this opportunity, so we've been able to do that for the last few years. We have quite a few recovery houses in Bucks County. So again, this is where we spent a lot of time making sure that we are providing to recovery houses. We're working with them on training, as well as replacements if needed. And then next slide, please, Sam. Our community distribution really took off in 2016. We opened up to our walk-in hours to our office, so residents are able to come into our office, of course not at this moment, and receive one-on-one instruction. These pictures here are kits that we provide to residents, which include not only resources, mouth shields, safer lock boxes. That's that picture in the box in the back. We also host community Narcan trainings, and most recently over the last year, we've partnered with a physician and a paramedic to also provide rescue breathing as part of our trainings. So you'll also see some of our resource magnets. So we really promote safe medication storage in the homes, as well as disposal. And then also in the far right corner, the bottom right corner, you'll see our family preparedness magnet, which actually is part of the presentation that the physician goes through in our Narcan presentation, which is kind of really helping families understand how they may need to be prepared at home, especially if they have a loved one, and kind of walk someone through the steps they can take. So this is all of what we provide normally with our community distribution. This is again with any events or naloxone days that we participate in. Next slide, please, Sam. And then this is just actually a picture of our EMS Leave Behind kits. So this was a partnership with our Emergency Health Services organization, which we really wanted to make sure we did, because they're the ones that are working with first responders on a regular basis, so they have great relationships already. We thought this would be a great way, especially when we're reaching out with EMS and fire. So the kits contain naloxone. So these kits are on all of the participating squads' trucks. Inside, they contain resources, training information. That little packet up top also has information they can provide to residents to follow up. And then, as Allegheny mentioned as well, with reporting, with all of, whenever we're distributing naloxone, we're making sure that we are providing an opportunity for whether it's a community member or an organization to let us know if they've used any of the units. And as Allegheny mentioned, it's very difficult with the community. That's pretty I liked what they mentioned about kind of how they've reframed it. We call ours a questionnaire, but we still, struggle to get many of those back. But that's one of the areas, we're continuing to work on. And I did see a question come in about the schools. It depends on the district. Some districts have it. The question is around, is this for all staff or just specific staff? And we're not providing a unit to every staff member in the building. This is how the district handles the naloxone. We usually provide one per building. And then depending on the district, it could be, the nurse, it could be other staff. So I hope I answered that. But now I will turn it over to Sheri.
Next slide, please. So over the past year, we've really increased the number of pilot programs with drug and alcohol treatment providers. So this includes some of our residential treatment facilities where they're typically distributing to individuals who are being discharged from treatment, because we know that transitions are such a high risk time for overdose, or folks that are leaving a facility AMA. And it also includes distribution to families in different venues such as family orientation sessions or family groups, or even visits with their loved one. We also have pilots with 2 of our assessment centers where Narcan is distributed to individuals who may assess as needing an inpatient level of care, but they decline that level of care, and to others who are at high risk. We very recently developed a pilot with a peer support agency for their community recovery center, and they'll be distributing both to individuals and to families. And so for all of our pilots, we do require that the pilot agencies provide us with a Narcan distribution policy and assigned standing order for the agency. And we do provide them with a list of the items that we need to see in the policy, or with a policy template, just to make it easier for them, and then they can customize it. And we do also ask that our providers give us a monthly report. It's a really simple spreadsheet that just says pretty much the date that they distributed, the category of the person, was it somebody who left AMA, was it a family member, and how many units were distributed. So we are also continuing our efforts for distribution through hospital emergency departments. And you can see here that we currently have 3 pilots in place. That's 3 out of 6 hospitals. And then a 4th hospital started their own pilot, which was really nice. We offered it to them, but they told us that they had, they had a supply and they were doing it with their 3 Northeast hospitals. That was nice that they did it on their own. I do expect that one of the other hospitals will begin distribution within the next, I would say probably 2 to 3 months. And I do want to talk just a little bit about some of the lessons that we've learned in working with the hospitals, because it can be a little bit different than working with, with other providers. So when we started our initiatives, Mallory and I made sure that we got buy-in from the hospital CEOs and the medical directors. That piece is always crucial. And if you're planning on doing a pilot and you know who the pharmacist is, it's always best to include them. The pharmacists wind up being a key person in the Narcan pilots at hospitals, because Narcan is a drug, it falls into their purview, and they're the ones who do the due diligence for the hospital, and they typically write the policies, not always, but typically. We found that it's also good to have a champion at the hospital to move the process forward. And with our pilots anyway, it's typically been the ED medical director or nurse manager, or it could be that pharmacist. We have learned that in general, it takes a very long time to put new initiatives in place at a hospital. You really need to be patient. You need to send frequent reminders and requests for status updates. And that's what I do. And I find that it's a balance between reminding them and being annoying. So I always try to not be annoying, but I know sometimes I am. But the point being is that it really does keep the project front and center for them, so it doesn't fall off their radar. And of course, we ran into COVID after we had put this out to the hospitals. So I did not communicate with them around this until I started getting communications from the hospitals saying that they were ready to move ahead with some initiatives. So I left them alone for a pretty long period of time. And then lastly, it can be more time consuming, but definitely worth it to work with large hospital systems as opposed to freestanding hospitals. There's not that many freestanding hospitals around. With larger hospital systems, approvals to pursue any new initiative just have to go through more layers, which takes time. Even a simple Narcan policy can take a long time. And so we are continuing to expand on all of these initiatives. Next slide, please. And so these are some testimonials, and this is what really reminds you that what you're doing is so worthwhile. So the first one is from a provider agency. They have two examples here. One is a father who was visiting his son while in residential treatment. They gave him Narcan, provided training, and the next day when he was leaving work, he came across a young man who overdosed. And he was able to use that Narcan that he had in his pocket to save that man's life. And then the other story is a teenager who came to the agency for assessment for treatment. She chose not to go to treatment that day, but she did take the Narcan. The very next day, her mother overdosed at home, and she was actually able to save her mother's life. And she did go into treatment that next day, and she now has 6 months in recovery. So really powerful examples that what everybody here is doing is just so worthwhile and life-saving. The next testimonial is from one of our emergency department medical directors, and I am just going to read this to you. So she says, this did bring up some opportunities to address stigma, and some staff members voiced their beliefs that we should not be giving Narcan away for free when others don't get meds for free. And the example is cancer patients, that this would just feed their addiction and that we're enabling patients, etc. And she goes on to say that it really did give us a platform from which to listen and learn. And ultimately, they believe that they were able to open minds and reduce stigma. So this was so powerful to me. This is an outcome that when we started, I didn't even think of, but it's such a great unexpected outcome to open minds and reduce stigma. Next slide, please.
Thank you, Sheri. So just to talk a little bit about how COVID has impacted our distribution, we really thankfully haven't seen much of an impact with our first responders. We communicated throughout the entire time, especially when we were, being told we needed to leave the office, but we were making sure that, all of our police and other first responders had the stock that they needed. And then throughout, we've continued with, our, no contact pickups and things like that. So with our first responders, thankfully, we didn't see much interruption. Overall, though, we did see a decrease in participation with many of our pilot programs at the drug and alcohol treatment providers. Just again, this was due to the, decrease in census at the agencies for a period of time. We're hopeful that, over the last, month or so, and then in, the near future, we'll see an increase. Probably, as Sheri mentioned, the hospitals, there was, of course, a lot of impact there. It did take some time, but Sheri, does highlight her style, and she is very good at being persistent and continuing a process along. So we're very thankful for Sheri and the work that she does, because she was able to move even some of these pilots along during a pandemic. I think that our community distribution is also one of the areas that, of course, that's been the most impacted. Currently, we've suspended our walk-in hours and our community in-person trainings, and it's very unfortunate because we had several that were scheduled in March and May. So we haven't been able to hold in person. We have been promoting the mail-to-home Narcan programs through some of the harm reduction coalitions across the state. We're continuing to do that. And most recently, we did partner with a neighboring county and a provider to host a virtual Narcan training, and we saw close to 200 people. So I'm sure many of you have kind of seen this happen within the virtual facilitation world. It does allow more people to participate. So it is an option that we are looking to explore more in the future until we're able to kind of resume our in-person training sessions. But we know that for many of our residents, we are in a big county. We are finding different ways. As Sheri mentioned earlier, we have a recovery community center in one end of our county that we've just started distribution with. So we're looking to kind of fill in those gaps until we're able to do the in-person trainings. And lastly, I think we just want to share that, you know, we think it's really important to have the collaboration within your own agencies. Sheri's been with us for a couple of years now, and it's just been great to kind of have her perspective, and she's really been helpful in moving pilots along in, you know, with not only our providers, but also in the healthcare settings. And we want to, of course, thank Sam for putting this together and for all of the times that we reach out with questions. Sam is a tremendous resource, as I'm sure you all know, and as well as Krista from Emergent. So it's really helpful to be able to reach out and ask questions, and if you have an idea to, you know, kind of run it by them. So that's it for Bucks.
All right, thank you guys so much, and for the kind words. And Sheri, I think I'm going to steal that phrase, persistent but annoying, borderline annoying. I totally empathize with that. So, all right, well, next on our agenda, we have Schuylkill County, and we have two fabulous folks, Janene from the Office of Attorney General and Melissa from the Schuylkill County Drug and Alcohol Commission. Ladies, I will let you take it away.
Good afternoon, everybody. I thought, Melissa, you were going to go first, but I guess I'll go.
No, I was on mute. I'm sorry.
Oh, okay. Do you want to go?
I'll go. I'm sorry. I'm Melissa Callion. I am the administrator of the Schuylkill County Drug and Alcohol. And this is Penny. Wait, I'll show you. She's 8 weeks old and she's a Great Dane puppy. Okay.
Just got her on Saturday. I'm jealous.
Thanks, Melissa.
And I'll let Janene introduce herself. We've been working with the Attorney General's office, and she can tell you kind of how our partnership got started.
Okay, thank you, Sam, for having us, and thank everybody else for their tremendous efforts to this COVID-19 and trying to get to our vulnerable population. So we do appreciate everything that everybody's doing, and thank you for having us on. We are honored, Melissa and I, that when Sam called us, we were like, what, us? What are you, okay. So, but thank you. I'll tell you a little bit about myself. I have a treatment background. I worked for a single county authority a long time ago when I graduated from college with a criminal justice degree. I worked for Carbon Monroe Pike Drug and Alcohol Commission. And I used to be a case manager back then when they used to have case managers, then they stopped it for a while and then they brought it back. So this is a great thing. Then I worked probation and parole for a period of time in Carbon County, and I've been with the Attorney General's office now for the last 21 years. My first position with the office was working undercover as a narcotics agent, so I bought drugs for a living. So I understand that population, and now I'm running our law enforcement treatment initiative across the state. My boss, General Shapiro, is very passionate about helping people with substance use disorder get into treatment. And also the important part of this is getting law enforcement involved with our single county authorities to be that connection to treatment. So I'm working very closely with all our single county authorities across the state and having that collaboration and partnership. So can you go to the next slide, Sam? So let me explain to you what Letty does. I go into counties when the district attorney wants to look at law enforcement being a connection to treatment, and law enforcement could be sheriffs, probation and parole, state parole, federal parole, anybody. And of course, boots on the ground, local law enforcement. So I go into counties and I help them create policies, working with the single county authority and working with the population and looking what are their needs, what are they looking to accomplish when they make a referral into treatment. And we also have to make the policy easy, because law enforcement sometimes is a tough group to talk to. And if we make a referral into treatment and the referral fails, law enforcement is not gonna move forward with doing any more treatment referrals. So it's very important that we work very closely with the single county authority to develop these policies. So when counties have policies, they actually reduce criminal behavior and it improves public safety. And right now with law enforcement, we need to have that. We not only arrest, but we also help people that are in need. So I work with Carbon County and Schuylkill County on these initiatives. So Melissa and I wanted to get together on this PowerPoint and work about and tell you what we are doing in the counties. So go ahead, Sam. Next slide, please.
Okay, this one's mine.
Go ahead.
Is this mine? This is
Yeah,
my...
go ahead.
Okay.
I saw your puppy. I didn't know if you were busy.
No. So we decided, we've always distributed Narcan, and I think when COVID started, it was our intention to figure out how to get the Narcan out there, and not have the usual trainings that we always had. And honestly, I heard it on a call somewhere that somebody did a drive-through Narcan, and I thought, wow, that is really great. And then I think it was a matter of getting together with Janene and saying, hey, oh, what do you think about this? And that's really how it started. But so what we do is we hand out a bag, and in the bag, and we should have taken a picture of it, in the bag is instructions how to use the Narcan. And then the Narcan, we put the dose of Narcan in there. And then I also have a card with all of our outpatient treatment providers in there. And my outpatient providers in Schuylkill County do the assessment and referral into treatment as well. We have information in there how to contact the SCA if you have questions. We also have a magnet in there that lists all of our take-back sites in the county. So, you know, stick it on the refrigerator is kind of the idea with that. And I think that we put a little more outreach information in there. And oh, I forgot, we put Letty information in there too, so the public knows that they can go to law enforcement if they're looking for help getting into treatment.
So let's talk about what kind of places that we decided to do the Narcan drive-thrus. Now, if you're going to start these, don't get discouraged right away, because there's so much stigma associated with even calling some locations and getting somebody on the phone to say, hey, can we use your parking lot just to do a Narcan drive-thru? This is really important. If you guys have an Elks Lodge in your community, this is one of their missions. So we started, our first one was at the Frackville Elks in Schuylkill County, and the president there was like, oh, drug and alcohol, helping people with substance use disorder is one of our missions. So if you have an Elks Lodge, they will provide you a parking lot to do a Narcan drive-thru, okay? We also reached out to borough buildings, and we had success with borough buildings. We also reached out to churches. If you have churches in your area that are on your opiate task force or any of your coalitions, please reach out to those reverends or pastors and priests, and I'm sure they would be more than willing to do a Narcan distribution in their parking lot. Also, our EMS and fire departments have been very good with helping us set up Narcan drive-thrus. And last but not least, we did one at a school administration building here in Schuylkill County. And again, they want to reach the public and work with the public. So, you know, those are some ideas on how you can find parking lots to do some Narcan drive-thrus. And believe me, once you create your poster and put it out, you might get some naysayers. But at the end of the day, the people that we want to interact with are, of course, people suffering from substance use disorders, people that are currently in recovery, people or family members that are in recovery, but they fear relapse. Right now with COVID-19, there's a lot of fear of relapse because a lot of people can't get to meetings because they're not having open meetings. And then, of course, this is a population that Melissa and I spoke to numerous times, that they're on opiate medications, but they're concerned for their liver and kidneys. And they think that they might have a possible overdose because of their liver or kidney functions. And also, and many of us in here might do this, at 8 o'clock in the morning, we take our prescription medications. At 10 o'clock in the morning, we're questioning ourselves, did we take our medications? And in our elder population, they forget if they take their medications or not. So we had a lot of people drive through it that were concerned about a possible overdose just because of medications. And I know we talk about just substance use disorder, but our elder population is another population that is in need of Narcan. And we had several people that came up to Melissa and I during the Narcan distributions and said, this is why I'm getting it, because I can't get off my opiate because of pain, but I'm afraid I'm gonna relapse, or I'm gonna go into an opiate overdose because of a medication. All right, Sam, next. So here's a picture. So far, we've done 5 events in Carbon County. We gave out 231 Narcan bags. Here is the difference because of our Narcan distributions in our counties, working with LETI, our Law Enforcement Treatment Initiative.
Oh, if I can just remind folks, sorry to interrupt, Janene, but if I could just remind folks to just make sure that you're muted, that would be great. We're getting a little bit of feedback from folks. So go ahead, Janene.
Oh, that's okay. So of the 5 events, we distributed 231 Narcan bags, and a little bit different with our Narcan distribution, and we're very lucky. We have a collaboration and partnership with our law enforcement. So there's the chief of police that is standing there with Melissa, and there's a car during one of, this was actually at the Elks Lodge. So we were able to do this Narcan distribution.
Sign that you received it.
Somebody's microphone is still on.
Certified mail. It's a violation.
I used my magic mute button.
Okay, there you go. Okay.
So Angela Morton, we did mute you, sorry. If you do want to speak, let us know, but I'll keep you muted. Go ahead,
Okay.
Janene.
Thank you. So, and here's a picture of the flyer, and DTAP has been awesome with us that they, a person creates the flyer for us once we send them the information. And we are looking at locations in Schuylkill County. Transportation is a big problem in Schuylkill County. So we are picking locations where people cannot get to the SCA or to a hospital to get Narcan. So we are looking in those types of areas, and we're looking also at areas of high overdose rates. So these are the things that we are looking at. Melissa, anything else you want to add?
No, I mean, I think you hit it. We're really trying to hit different points in the county just to get the outliers. So we're trying to get at least every end of the county that we can. And just like you said, Janene, law enforcement has been really helpful in this, really supportive of our efforts.
And we had the district attorney, we did one recently in Carbon County, and the district attorney actually stood outside when it was 90-some degrees with us and gave out Narcan. So we really appreciate the collaboration and partnership with all law enforcement all throughout the counties that we are working in right now. It's very important it's interesting when people come up to us and they look and they go, what's this cop doing here? And there's been so many stories of people walking up to police officers and go, oh, you arrested me. We had a gentleman that went to state prison and he got arrested for a high-speed chase. He apparently went through 2 counties, high-speed chase at 110 miles an hour. He was in state prison. He's currently in recovery, but his brother is not. And he stood there and talked to the chief of police and myself for over a half hour and said, you know, at one time I used to dislike you guys, but I turned my life around because of law enforcement and because of an arrest. And he was there wanting Narcan for his brother because he's afraid that his brother is going to die. So we're reaching that population, which is interesting because you would think that they would never come to a Narcan distribution with law enforcement standing there or the district attorney, but they do. Next slide, Sam. There's a question that do we advertise law enforcement? Yes, we do. Our logo there is Law Enforcement Treatment Initiative. It's on every flyer, and we also put the county seal of the county that we're working in. So yes, everybody knows that law enforcement will be there. So Melissa, do you want to do the last slide?
Well, I'll go through it and you jump in if I miss something. So like I said, we're really trying hard to get to every community that we can in the county. And we do have 5 more scheduled. And like Janene said, the nice thing is someone from DTAP actually helps us with the flyers, and they're nice. Like I really appreciate their help on that. we're going to be doing billboards, kind of just advertising the fact that we have the law enforcement treatment initiative here in Schuylkill County, and just that people can go to their law enforcement if they're looking for help to get into treatment. We had grant funding with our law enforcement initiative, and we were able to provide training for first responders. So we started our trainings. We've had one so far because of COVID. But so we're planning on at least another 5 trainings. And really it's a lot of stigma, it's addictions, it's trauma. It's kind of a little bit of everything that the law enforcement get, just so they have an understanding of what it is we're doing. And then of course, Janene does a piece on the LETI, which is really their main reason for being at the training. And the other thing is our Schuylkill Reach. We started Schuylkill Reach, it was actually our DA, Mike Opaque, wanted to have an opioid coalition, and that somehow with getting everybody involved, we turned it into Schuylkill Reach. But it's with those meetings that we've made so many connections, and that's kind of how Janene was even able to talk to our DA and push the LETI program. So our Reach Coalition has been, you know, really helpful and moving things along in Schuylkill County. Am I missing anything, Janene?
You did a great job. So that's how we are working in Schuylkill County. And of course, like I said, I think I see Chris on this training, worked with Carbon County with having a law enforcement treatment initiative, Narcan drive-through. So this is what we're trying to do during COVID-19. I know you guys wear a lot of hats throughout the day, and a lot of the information that we have provided in the past, you're well aware of. So we just wanted to think out of the box and show you how we are getting training facilities, or parking lots, I should say, and then how are we getting Narcan to our most vulnerable populations. So thank you for having us, and we appreciate the work that all of you do every day. Thank you.
Thank you.
Yeah. Thank you guys so much. And thanks again, Melissa, for sharing your adorable new addition to the household. We appreciate it. It certainly brightened my Thursday. So up next, we're going to have Brianne from Washington County. So Brianne, you want to go ahead and take it away?
Sure, you can go ahead and go over to the next slide. All right, so I'm Brianne. I'm the project coordinator here at Washington Drug and Alcohol Commission. There's my contact information. You can go to the next slide, Sam. Washington Drug and Alcohol Commission does serve as the single county authority for Washington County. We serve all Washington County residents. We house an administrative, fiscal, prevention, and case management unit. And our vision is to ensure every individual has the opportunity to achieve and sustain optimal wellness. I also wanted to share that I am on our Washington County Opioid Overdose Coalition, which is heavily involved with anything related substance use disorder. Our district attorney here in Washington County is one of our biggest partners and supporters. So it definitely does help having his support. He also is the co-chair of our coalition, along with Cheryl Andrews, our executive director. Next slide, please. So we just recently started doing a lot more Naloxone effort. We have had Narcan out in the community, or within first responders and school districts, ambulance and chair services, but we're really pushing for community Narcan now. What better time to do it than now when you know, community members are actually kind of separated from what we're doing given the whole COVID-19. Our services have still continued. We haven't stopped case management and anything like that. Like, we're still providing services, but it's all done virtually. So I appreciate the feedback, especially from Schuylkill County, that don't get discouraged, because we've done 2 Narcan trainings. Our first one was a success. Our second one, not so much. I won't be all negative about it, but it was definitely stigma was known. Jana, I saw that she was on this call from Fayette County, so she can speak on that as well. It was a collaboration between Westmoreland counties, Fayette counties, and Washington counties. We only gave out for Washington 15 Narcan kits. So we are, going back out it again today. We actually have a distribution this evening in Burgettstown. We've done a collaboration with Cornerstone Care, which is a doctor's office here in the county. So we're looking forward to that. And we also are going to go forward with an event in Washington again, hoping that that one is a good turnout as well. The city of Washington in itself is a really strong recovery community, very recovery supportive, overall treatment supportive and everything. So we're looking forward to doing that. We're actually planning to do something a little bit bigger. Since it is during Red Ribbon Week, we are looking to maybe bring in some prescription take-back boxes as well. So trying to do a little bit of a fair per se to bring more community members out and to get Narcan. I do appreciate the feedback from like the Elks Lodge. We have an Elks Lodge that's local, so we can always look towards reaching out to them, especially for the Washington location. You can go ahead with the next slide, Sam. So our prevention kits include 2 doses of Narcan, a breathing mask, rubber gloves, if we can get them, an instruction card, as well as a resource card that has our contact information, as well as the Centers of Excellence here in the county, since they do work with opioid overdose, or just opioid, those that suffer from substance use disorder with opioids in general. And then we also have the utilization reports. I appreciate, the feedback that has been shared about these utilization reports, because one of the hardest things is getting the reports back, whether it's from, individuals themselves or even our first responders. We have a very difficult time getting these forms back. So the online resources that you guys in Allegheny County shared, I took notes and are very helpful, something that we might have to look towards. And, we let them know, like, the reports are specifically for us to know that it was used and we can get you another kit. But changing the verbiage of it is definitely something that we can consider. Next slide, please. This form here is our naloxone acknowledgement form. We haven't had too much issue with getting it filled out. Here for our community Narcan distributions, we actually fill it out for the person. The name and phone number is the most important, because with my position as project coordinator, I made it my goal to provide follow-up calls with individuals that we received utilization or that we distributed Narcan to. For the most part, people aren't too leery about filling out the form or giving us the information. I think the help there, though, is that there's the trust between us and the individual, knowing that Washington Drug and Alcohol Commission is a safe place for those that suffer with substance use disorder. We try to get ourselves out into the community as much as possible, like I said, to build that trust. I haven't had too much luck getting hold of anybody for these forms. So just kind of taking it day by day. I do know that what we do is appreciated. To share at one of our Narcan distributions, it was actually our very first one, and one of the last people that came through, we had a guy pull up. He told us immediately he didn't need a kit, and at first we were like, well, why are you here? But we gave him the chance to talk, and he shared with us that he lost his son, I want to say like 15 months prior to the event. And he was just very grateful that we were getting Narcan out into the community. He shared personally that he struggled with, you know, accepting Narcan, and he struggled with accepting MAT as an alternative for his son to be sober. So he just had a complete and total change of heart, having lost his son, earned the appreciation of, you know, Narcan and all the other alternatives that are out there for substance use disorder. So while he was talking to us, like my coworker described it best, it was like the world stopped all around us. Just A, we weren't expecting it, and B, you know, to know that what we're doing is appreciated goes a long way. Next slide, please. And we also have a collaboration to help us get Narcan out into the community. I'm one person, Washington County is a lot of people. So we work closely with Ryan Frazee. He works for the Department of Public Safety. He's also a co-chair with me on the Naloxone Harm Reduction Subcommittee for the Washington County Opioid Overdose Coalition. This has been in effect since I began Narcan distribution. And it's just very helpful. He has the connection with first responders and whether it be police or fire. So when I'm not able to get Narcan out, he can get Narcan out pretty much immediately. Another way we started distributing Narcan during COVID-19 was to mail Narcan kits out, especially to our clients that couldn't get into treatment immediately or refused treatment. We always made sure when we were in person that we were sending Narcan kits out with our clients. Just a little bit of facts for how we've been doing Narcan distribution. It started in 2015, probably about June, July 2015, and since then we've distributed 4,844 kits. Of the reports we've received, or of all the kits that we have out, we've received 488 utilization reports. Of those reports, 40 were fatal, so pretty good numbers. I mentioned that a lot of our Narcan that we've distributed goes to police, fire departments, emergency responders, doctors' offices. We even have schools that have received Narcan. And I believe that's it for facts. I also added, actually last week, due to the extension of the shelf life for Narcan expiration, I made stickers just out of like address labels that I've been putting on our kits that put the brand new expiration date in bright red. So that way people are aware. Next slide, Sam. And like I said, we have some upcoming naloxone distribution drive-through sites. We are looking to go back towards the Mon Valley area. Charleroi is where we held the second training. That wasn't a good turnout, but we are planning to go back towards that area, hoping for a better turnout, maybe a better location. I have done a few naloxone trainings for different agencies through Zoom. And we are, now that we have the availability to, prior to becoming a CCE, we were limited in Narcan. So we couldn't really get it out into the community as much as we would have liked. So since becoming a CCE, we've been able to get that Narcan out into the community through our drive-throughs, but we're also looking to do more advertisement for Narcan availability at the office. You know, we hate to turn people away, so we're able to use the Narcan purchased by the SCA to get it out into community members' hands, you know, in those that typically don't fall within the first responder category. Next slide. That might be my last, I'm not sure.
Yep, that was your last one. So I didn't see any questions come in through the chat, other than comments kind of reaffirming your statement, Brianne, about sort of being confronted with that much stigma at those events and not getting discouraged. So I'm going to go ahead and invite Bob Willis, who is our last but certainly not least presenter, and who I believe is hailing from a Panera somewhere in York or Adams County. So Bob, do you want to go ahead and take it away?
Absolutely, Sam. Really appreciate the opportunity to kind of share some of the exciting things that we're doing here in York Adams. And what's really cool about this particular webinar is it kind of shows how at least our county has learned about some of the initiatives that we're doing. We've learned from other counties, and the more that we can get ideas out there, the better opportunity everybody has to get Narcan into the hands of everybody. So I really appreciate it. So I'm the prevention specialist and Narcan coordinator for York Adams Drug and Alcohol Commission. Go Ravens. That means next slide. Thank you. Sorry, inside joke. So York Adams Drug and Alcohol Commission, we are the designated SCA for York and Adams counties, and we're responsible for coordinating the local drug and alcohol prevention, the intervention, and treatment-related services for both counties. We have functioned as the CCE since 2017. And we have seen, just as everybody else has, a massive increase in overdose fatalities during COVID. It's more than double from our numbers last year. Next slide, please. So some of the things that we've been doing, we have not only worked with your traditional first responders, the fire, EMS, police, but we've also worked with schools, libraries, the mission, inpatient and outpatient providers and churches. And a couple of years ago, we started a partnership with a local pharmacy, Minix Pharmacy, to help us deliver our orders. They are able to, yeah, sorry if the background is too loud here at Panera, I apologize. They have helped us out tremendously. They are able to get orders on most cases within 24 hours of receiving the order. They deliver to most areas in York and Adams counties. And since working with them, we have distributed over 3,200 units, with close to 600 of them being public units. And as you can see, we have a picture of our public units there on the right. We normally reserve those for EMS to leave behind. But one of the things that we came to realize, or had a different interpretation of the state standing order by our solicitor. So we've been wanting to get Narcan out into the hands of the public. People have been asking us to be able to get Narcan into the hands of the public. And now, since our a new interpretation by our solicitors, we have finally started to do that. We also do Narcan training to anybody who's interested in getting it. It's informational only. We do refer people to get trained via the PA Virtual Training Network. We also do trainings within our local government. And since we have been trying to get the Narcan out to the public, we have come to understand that prisons are a vital interest, because 67% of all our fatalities in York County once served time in prison. And so if you could go to the next slide, please. So we have started a partnership with Adams County Adult Correctional Complex, as well as the York County Prison. You going through their healthcare provider, Prime Care. And those, Prime Care then gives the Narcan to those returning citizens who are being released and have been identified as having an OUD. We are looking to include more recovery houses in our list of entities. We are planning on 4 public distribution events next month, 2 in York County and 2 in Adams County. And we're also collaborating with our local opioid collaborative, the York Opioid Collaborative, utilizing the Vital Strategies grant to create an online ordering platform, which the public will be allowed to order Narcan, but not until they finish an online training. So we're really excited about hopefully getting that started in early 2021. And I believe that's, since I had to go last, everybody else stole all my ideas. And it's probably better since the background noise is kind of interfering with everybody. But any questions, my contact information's there. Please reach out.
That sounds great. Thank you so much, Bob. We appreciate you sort of rounding out our presentation today. I did see that we got a question a little bit early in your presentation around kind of asking about, as a CCE, are we restricted in distributing our kits to agencies, or can we distribute to the public directly? So under the new program guidelines, you know, we certainly encourage folks to think about both strategies. What you've heard today, whether it's the drive-through distribution programs or being able to open up, you know, distribution and pickup through either office visits or porch drop-offs. Those are exactly the types of ideas that we're happy to support using our PCCD funded and SOR funded kits. The only thing that we ask is that folks just document that. And I know for individuals that can be a little bit tricky. We certainly don't want folks to feel like they have to put, you know, a unique person's name and address to document, but in the aggregate, just making sure that you're capturing that those kits were going out to folks in the public. So I'm happy to work with anybody who might have questions about what that looks like for your specific CCE. Again, I know depending on how the program is structured or the initiative is structured, it might look a little bit different, but there are options to do that. And we certainly encourage folks to think about those individual distribution strategies in addition to obviously continuing the support with your more traditional first responder groups as well. And thinking about who is best positioned in your community to maybe make outreach to individuals with the greatest need. So if that's you as a CCE, great. If it's somebody in your community that you need to make a partnership with, fantastic. Again, I can't thank folks enough for taking the time to share their stories today. My job is great because I get to work with really fantastic, talented people. One of the ideas for this webinar was, you know, a lot of times I talk to CCEs directly, I hear about the amazing work that they're doing, and I wish more people could kind of know that information. So I'm just so glad that this came together. I think it's a great way to mark National Recovery Month. And our thanks again to all of our presenters. Their names and contact information is listed here. Feel free to reach out directly. Like I said, we'll share slides afterwards as well. So you'll have this for posterity, and we'll also share a link to the recording. But before we wrap up, we do have about 10 minutes or so left. I'm happy to answer or refer to any of our presenters if there's any questions that folks wanted to ask, or if there's any comments from our participants.
I did share in the chat box, but I will share here too. It was noted on my slide. But I forgot to mention, we have a ton of expired Narcan kits and have no idea what to do with them. So I finally had this genius idea to use them for training tools. So, you know, if you have expired Narcan and don't know what to do with them, like I said, it's great for people that don't know how to use Narcan. I feel like there's a fear to responding to an overdose. Even me having trained multiple people, you know, just showing them that it's this simple to use. Highly recommend using them as tools.
That's a great idea. And Brianne, that reminded me, I loved your suggestion. Obviously, the 12-month extension of the shelf life of Narcan, that's a huge deal. And will hopefully reduce the amount of expired Narcan that CCEs have. But I loved that idea of, you know, just quick adding a label. It takes a little bit of extra time. I'm sure it wasn't the most fun thing in the world to do, but I think it'll definitely help to kind of avoid some confusion in terms of, is this kit still good or not? So I know Krista Palachek from Emergent Biosolutions is on today's webinar. Certainly she's a great point of contact if you or any of the community partners that you work with have any questions about that. But I really liked that suggestion. I thought it was a good and creative idea. I'm taking a look at the chat function. Oh, we have lots of things coming in. So with the year extension for expiration dates, how do we know when the expiration dates are correct with the 3-year? I think the answer is you just add 12 months to whatever expiration date is printed on the kit. But I will double check that with Krista to make sure.
Yeah, that's actually, Sam, that's a good question. I mean, right now with the units we have, we can do that. But what about, will the new units being produced have a 3-year expiration date or a 2-year expiration date?
Yeah, so I'm gonna just, oh good, is Krista on? Good.
Yes, I am. So, and forgive me if you hear background noise, but so right now, you are good to add 12 months to any existing product, any product that you get, even moving forward. I know a lot of orders were just placed recently. There will come a point in time where there is a hard date stop. We are also working on some other platforms, an online tool where you'll be able to go in, put a lot number in, and it'll tell you, is that true 36-month dating or 12-month dating? There's going to be a hotline. There's going to be a multitude of resources so that you can check lot numbers before you get them out into the community, or you can kind of put those resources out to your community partners. Right now, we are still working on it behind the scenes, but right now I can tell you the 36-month dating has not hit our packaging yet. So right now, add 12 months to whatever the dating is on your package, whatever the expiration date is on the package. And then moving forward, once all of that information comes, you will be sure to hear from me. I will send it directly to you. You'll be, I'm sure, hearing from Sam, the state, everybody. But we will make sure that you are fully abreast as to what's going on so that you have correct dating on your product. I hope that's helpful.
Thank you so much, Krista. As usual,
Oh, you're welcome.
a wealth of information. I appreciate you jumping in. Any other, I see we have one request. Can some of the presenters expand on their way of, quote, training? So I don't know, Brianne or Bob or Melissa and Janene, do you have any thoughts on that question?
Well, when we're doing like our Narcan drive-through distributions, or when they aren't an actual, you know, in classroom style training, we've just been kind of, this is how you respond to an overdose, do the whole peel, place, press thing. Our kits also have a card, which I can send. If you guys are interested, I can send that information to you on how we are, you know, kind of educating people. You know, like I said, we're just doing that example of this is how you use it. And the card also contains important information, like if you have to walk away from the person, put them in recovery position in case they do aspirate, you know, just those types of things, but mainly just insert it into one nostril, administer the dose, wait your 2 to 5 minutes, insert that in the opposite nostril, and, you know, stress the importance of calling 911. But our trainings that are in person or done virtually, they're more in depth. But just with the distribution, it's short, sweet, and to the point. A lot of the times you'll find people that do know how to use it, so that is helpful.
And
That's
this
great.
is where and from Bucks County. So for us, the training depends on kind of, how we're distributing. So when people were coming to our office to get Narcan, we have a computer that's got a video on it. We would watch the video with the person, ask them if they have any questions. We present them with an overdose prevention toolkit that's got a whole bunch of different materials in it. And, we just try to start a conversation and answer some questions. And then when we're doing more of a community Narcan event, which of course we're not doing right now, but we partner with one of our providers, and they do about an hour-and-a-half presentation that really goes through what is substance use and kind of leads up to how do you administer Narcan and, all of that. And we have, as Mallory pointed out, we have partnered with a physician from Penn who comes along to those trainings, and she teaches from her perspective, and we have a gentleman who does CPR. So the two of them, the doc and the CPR person, really teach rescue breathing. They usually bring the dummies with them so people can try them out. And so that's typically a more comprehensive, bigger training. And we've had some really nice turnouts to those trainings.
So at York and Adams counties, it's informational only, as I said, but we go into, we talk a lot about prevention. We talk a lot about the student assistance program. And then we also talk about access to treatment, as well as getting help for those family members and friends of people who are in the midst of their opioid use disorder. We really try to highlight that because we feel that a lot of people don't take the time to take care of themselves when they're dealing with a loved one in that situation.
That's a great point. Thanks, Bob. And I think that's a good place to wrap things up. We did get another question in terms of how many doses are usually provided. So I saw that Brianne noted that it's usually 2 doses. I think generally speaking, that's what I've heard as well. We are right up at time. I just really want to, again, thank all of our presenters and also thank our participants. I certainly know folks have a lot of Zoom calls on their calendars these days, so we appreciate you taking an hour-and-a-half out of what I know are very busy schedules to be with us today, to listen and learn, and really encourage you. Again, we'll share information as follow-up. I promise I'll unhide Bob's contact information, so feel free to reach out to me, to any of them, and looking forward to maybe having another one of these webinars where we have some new faces and folks sharing some ideas that maybe they took away and implemented based on today's discussion. So thanks again, and hope everyone stays safe and continues to be well. We'll talk soon.